Physique assessment. The question our expert panel addresses is: what are your key tips for body composition assessment for athletes? Associate Professor Deborah Kerr.
Well, I'd like to think about making sure the athlete is prepared. So the athlete should always know why the body composition assessment is being conducted. They should be prepared so they know what to wear the appropriate clothing and what will happen with their data. So these are my key tips. So obviously it's also incredibly important that the person conducting the measurements is well trained in doing the measurements.
Associate Professor Gary Slater.
First and foremost, we really need to be able to understand what outcome variables, what things do we want to monitor with the client. Then it's important to be able to understand the resources that are available, the time and the finances or the equipment that are available to be able to assess that. And then it's also really important to keep in mind how much of an association is there between physique traits and competitive success for that particular sport. And these should direct and guide whether or not you're assessing body composition, the resources that you have available to you, or the technique that you have available to you, and then how frequently you might assess body composition within an athletic population.
Dr. Kagan Ducker.
I think one of the most important ones is to know what tool you're using and to know that what you're collecting is valid and reliable and is actually showing you what you want it to show. And certainly the key tips is, especially working with athletes, is to remember that it's confidential and that sometimes it's not the right time to present the results that you're collecting. You've got to pick when's the best time, and is it really going to give something to your athlete as opposed to giving them something that might actually hurt how they're performing.
Professor Tim Ackland.
Well, first you need to choose an accurate and reliable methodology. Secondly, use a standard protocol with standard patient or participant presentation. Thirdly, understand and know your error of measurement, and report the data in a simple form without introducing further errors by trying to convert to a percentage body fat, for example.
For further information on physique assessment, see our book, Best Practice Protocols for Physique Assessment in Sport, published by Springer.